This is how I go into an intensive care unit that has a patient with COVID-19 proven infection. What I would be wearing is an N95 mask and a face shield. Now, I want to show you the benefits of masks. Any mask, even a simple mask made at home, and I will show you why, theoretically, any kind of face covering is better than no face covering. The argument of certain people who don't want to wear the mask say that this virus is so small that it can go through any pores, basically, and no mask is going to stop that. That is an accurate argument. But what we also know is this. With viral illnesses, in fact, with any illness that's infectious, whether viruses, bacteria, or other infections, the amount of the antigen or the amount of that foreign protein, in this case, the COVID-19 virus, that you get exposed to will lead to a certain disease, be it a mild, a moderate, or a very bad disease. Obviously, there are other factors such as your immune system. In other words, if you get exposed to, and I'm going to just throw a number here, if you get exposed to 1 million viruses in your mucous membranes at the same time, is going to be totally different than being exposed to 10,000 viruses. And the difference is going to be, if you have that lower amount of virus, chances are you're not going to be as sick. And chances are your immune system, as far as if you have a good immune system, your immune system will be able to overcome those viruses before they replicate and cause havoc on your body. So let me ask you this. If somebody is sneezing, and let's say they don't have a viral infection, would you want to have all that sneezing on you, or would you rather have that minimal to no amount of that yucky substance on you? So we all want the minimal to no amount on us. So having a mask helps in one of two ways. For the patient, for the person wearing the mask, if you have a viral infection such as COVID-19 and you cough or sneeze, and suppose in that cough or sneeze, two things we need to consider here. One is how many viruses, how many viral particles is in that cough or that sneeze. And two, what is the distance that the force of the cough or sneeze transmits these viruses? Without a facial shield, the amount that you produce is going to be the same. Let's say 1 million viruses, and it can go up to 8 feet. We say 6 feet, but studies have shown maybe 8 feet or even more. Covering your face with a simple house-made mask is going to prevent 90% of those viruses from coming out, and the distance is going to be certainly much less, down to probably 2 feet. So the people exposed to you, if they get that virus, the amount of virus they will get is going to be minimal. Hopefully, that leads not only to minimal or no illness, but potentially, and again, this is potential, I'm not advocating that people go do this. If you get exposed to a low number of viruses and your body is able to overcome that, you can develop an antibody against the virus and become immune. And so you won't be a potential patient, or you won't be infected with COVID-19 down the line. That by itself proves why it's important for us to wear masks, whether we are a patient that is producing COVID-19 particles or SARS-CoV-2 particles, or we are another individual who's trying to protect themselves. And so the amount of viruses that come out and then ultimately reach your system is going to be much less, to the extent that potentially you could form antibodies and potentially you could become immune against it. Again, there's no studies to back that, but it makes sense. Now, Obviously, wearing a face shield and an N95 mask is going to make my risk the least compared to other masks. But don't forget that this is a patient that I am examining who is in an intensive care unit. Therefore, they have an extremely high viral load, and they would probably put anybody around them at the highest risk. People in the community who are not sick or minimally ill probably don't have as many viruses in their system, and so when they cough or sneeze or even breathe, the amount of viruses that they produce or they transmit into the atmosphere is not as much. And protecting yourself with a face mask, be it an N95 mask or a regular surgical mask or even a house-made mask, whether with a filter or without, is definitely better than not having any protection at all on your face. This topic should be put to rest also. Now, there is a lot of, could be controversial or could be just evidence that needs to be proven, but if you've ever been to China or to Japan, you see that it is a social norm that if somebody is sick or not feeling well, they wear a mask in public. In fact, if you walk around the streets of Tokyo, like I have done many times, you see that a lot of people are wearing face masks, and this is way before the pandemic. Now, look at the numbers of viruses or of patients in China, a country that has the most people on Earth. And you see that the number of infections is relatively low. Now, I do not necessarily trust 100% their reporting process. However, you can probably hide 10,000 patients, but you can't hide 2 million patients. So the number of patients is definitely lower than what we expect, or lower than the rate that we have in the United States. Could it be because of their practices of wearing masks in the first place? And obviously, as an authoritarian regime, they were forced to wear masks. And so could that have helped them? The social distancing, the wearing the mask, and so on and so forth. Now, the best thing about this country is freedom, and you cannot force people to do anything, but as ethical human beings who care about our fellow human being, the least we can do is wear a mask, whether we are ill or especially, whether we're not ill or especially if we are ill and we feel that we're under the weather. I definitely recommend wearing masks. If you're in public, once you get out of your house, I do it all the time. I have my surgical regular mask all the time, and even in the hospital, I wear my surgical mask, except when I know a patient has COVID-19 in the intensive care unit, then I go full out. There has been arguments against wearing masks. Unfortunately, there are things that apply in normal life and things that apply when you are dealing with a pandemic. So this is definitely not normal everyday living. I am not aware of the bad problems that happen as far as oral hygiene is concerned. I know that some people can't wear a mask, or they feel short of breath if they wear a mask, and so on. And I understand all of that. But does that make it to where everybody shouldn't wear a mask? If a certain person cannot wear a mask because of they cannot breathe if they have a mask on, then get a face shield. The face shield, you will not be, your breathing will not be inhibited because you have nothing on your face, and at the same time you protect yourself and others from the viral particles that potentially could be there. We could make an argument, or we could be devil's advocates all day long. But reality is, this is a pandemic and we're trying to get rid of it. Just like as a healthcare practitioner, as a public health practitioner, if a patient has tuberculosis, I'm not going to let that patient walk around with no protection and infecting other people with TB, why would I let something as deadly as COVID-19, why would I let patients like that walk around with no masks? Knowing that there is about up to 40% of patients who have COVID-19 that have no symptoms, yet they can transmit the virus to other people. So again, let's be ethical. Let's care about our fellow human being. Let's wear a mask. It's a simple process. And let's put politics aside. When science rules, politics has no place.